Well, it's a fact that medical doctors in America each year kill more people than the mafia does in 1,000 years. That's a fact. Now, also a fact, this is from the Center for Disease Control and the Journal of the American Medical Association, February 7th, 2007, February 5th, 2007, yeah, okay. 15 million Americans are killed, injured, and infected each year in the workplace of doctors. We're talking about hospitals, private clinics, and clinic groups. 15 million are killed, injured, and infected each year. Now, how many people would fly commercial airlines if you knew that they killed, injured, and infected 15 million passengers a year? How many would eat from a particular brand of fast food franchises if you knew that they killed, injured, and infected 15 million of their customers every year? Nobody would fly. Nobody would eat at that place. If people continue to go to doctors, I just find that amazing. Each year, this is from the Center for Disease Control again, 2 million Americans are infected in hospitals each year. Of those 2 million who are infected in hospitals each year, 90,000 die. How many of you would take a cab if you knew that that particular brand of cab would kill 90,000 passengers every year? Nobody would take a cab. 15,000 a month seniors over the age of 65 are killed each month. 15,000 a month, that's 70,000 a year. 70,000 a year are killed each year over the age of 65. If you're over age 65, and commercial airlines were legendary for killing 15,000 seniors over the age of 65 passengers. How many would fly if you're over age 65? Nobody would fly over age 65. They take Amtrak and the Greyhound bus. So why is it that people continue to go to doctors? Well, somehow the doctors have been able to convince everybody how wonderful they are, okay? And people have bought it hook, line, and sinker. Now, what I want you to do is take responsibility here, take care of yourself. Now, in a couple of months, I'll turn 75. I haven't been to a doctor with me being the patient in 68 years. I've never been on a prescription medication. If you look at my health file, there's only one piece of paper in it. That's my birth certificate. If everybody were like me health-wise, the medical system in America would be real humble, wouldn't they? Okay? Well, I want you to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy, and you'll learn how to do your own lab tests, how to interpret lab data that your doctor's taken from your own blood sample, right? You can go to a drugstore without a prescription. You can get test strips for urine tests. They'll see if you have blood or protein or infection in your urine. You can actually get a blood test yourself without a prescription to see if you have diabetes. You can get your A1C hemoglobin, your blood sugar. Also, you can actually do your own equivalent of a colonoscopic exam. You don't need to have some drunk alcoholic doctor sticking a garden hose up your rump and puncturing your intestine and killing you. You can get what's called an occult blood test for like $3, and the new one out is called FIT. That's a fecal immunochemical test. And these will give you the same information that a colonoscopic exam will do, but it'll cost you like $5. Whereas a colonoscopic exam, of course, your insurance company or Medicare will pay a couple of $1,000. But there is risk of death from those tests. Why would you do that when you can do it all yourself? You know, when you get together for Christmas, for holidays, for birthdays, for anniversaries, what you want to do, Thanksgiving, take your whole family and do all your own tests. The book, Let's Play Doctor, and the trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy, Let's Play Doctor, teaches you how to do all your own tests, how to read the numbers, what they mean, and so forth. You'll be amazed. In fact, I talked to a lady this morning. Her cholesterol was like 140 without medication. Her doctor was just saying, man, you're lucky, blah, 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 blah. Well, she was in trouble because she had a gluten intolerance. Turns out she had psoriasis. She had irritable bowel syndrome. She had so many operations on her belly and her intestines and her uterus taken out and all this kind of stuff. And that's because the doctors either missed it or recognized it and were taking advantage of it. She had a gluten intolerance and couldn't absorb things very well. And so she had all these diseases, all these surgeries, all these degenerative problems. And the giveaway was that without medication, her cholesterol was 143. Well, it should be between 220 and 270. There's not a single disease caused by elevated blood cholesterol. I'll repeat that. There's not a single disease caused by elevated blood cholesterol. But you get your blood cholesterol down below 200 with statin drugs, with a cholesterol-restricted diet, you're at high risk of type 2 diabetes. You're at high risk of Alzheimer's disease. You're at high risk of erectile dysfunction and low T. You're at high risk of adrenal failure or adrenal exhaustion. You're at high risk for things like menopausal symptoms, when really you can get through menopause, ladies, in like 3 seconds. but you're going to spend 30 years dealing with menopause and all the hot flashes and night sweats and all the emotional stuff when you get on a cholesterol-restricted diet and take statin drugs to lower your cholesterol. Because guess what estrogen, progesterone, adrenal hormones, and testosterone are made from? Oh yeah, 95% by weight is cholesterol. And so these are the things you have to know, because doctors will mislead you. I just see so many of this. I mean, this weekend, I've had people who had osteoporosis were misdiagnosed with cancer. They were told they had cancer. They really just had osteoporosis. And they were told they were being put into hospice because they're already in stage 4 and so forth. And it turns out all they had to do was get off the morphine because they had pain, so the doctors put them on morphine. And they had B12 and folic acid anemia, and they were told the cancer was eating up all the red blood cells. Are these doctors really that ignorant? Or do they just want to take advantage of you when you're hurting? Because they can tell you anything, and you'll buy it. Well, stick with us. We're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us?
I thought we'd continue talking about these medical mistakes you were talking about in your monologue there. I've got a Fox News story here headlined, "At least 1 in 20 outpatients misdiagnosed every year," according to a study that was published in the British Medical Journal, Quality and Safety. So they analyzed data from 3 earlier studies that indicated that misdiagnosis rate among patients who received treatment without being admitted to the hospital was approximately 5%. When translated to the entire population, the researchers estimate that it's 1 in 20 adults, or 12 million people, misdiagnosed every year in this country. According to the lead researcher here, a Dr. Hardeep Singh, researcher at the Michael E. DeBakey VA Medical Center in Houston, Texas, also an associate professor at Baylor College of Medicine Safety. And he goes on to say, "We called it a misdiagnosis when there was a definite missed opportunity to make a timelier, correct diagnosis based on information available at the time." They noted that while much progress has been made on patient safety in hospital settings in recent years, I would tend to disagree with that. They focused on the outpatient experience. And according to this Dr. Singh, he says, in some ways, in outpatient care, it's challenging. Patients move between different systems of care, specialists and radiologists. They analyzed outpatient misdiagnosis rates from hundreds of medical records. The first study analyzed misdiagnosis in a primary care setting. The second and third studies analyzed misdiagnosis among lung cancer and colon cancer patients. And on that, I would say I had a personal experience with that, as my father died from lung cancer a couple of years ago. But the year before he was diagnosed with lung cancer, he had been treated for pneumonia 8 different times at an outpatient clinic. And if anyone knows anything about lung cancer, that is a classic red flag sign that someone has lung cancer, when they have chronic recurring pneumonia and it was missed. And by the time they found it, the poor man had a huge tumor in his lung that was obstructing him to the point where it was pressing on his heart and making it difficult for his heart to work. But in this study, they say, in each case, the researchers were characterizing misdiagnosis at times when patients presented clear symptoms that were either missed by a physician or not properly followed up on. Says that emphasized red flag for disease often develops slowly. The study only considered patient misdiagnosis when clear symptoms were missed by a physician. Probably one of those physicians, that researcher that did the study where he took all the blood samples and found that, 56% of ER doctors were either drunk or on some sort of drugs?
Yeah, exactly. Lucien Lepay from Harvard Medical School is the guy's name, PhD in public health. And, that was about 12 years ago. And, of course, there was an article that just came out yesterday. It was my monologue from yesterday, where all these physicians, it's kind of like, again, another one that says 50% of the physicians are intoxicated on alcohol, street drugs, and prescription drugs during their working day. And that's where I think we're going to solve this problem. The only way we're going to solve this problem, Doug, is to require urine tests from doctors when they show up at the front door to come to the clinic or the hospital to work. And surgeons, 15 minutes before each surgery, they have to get a urine test to see if they're intoxicated on alcohol, drugs, or street drugs or prescription drugs. I don't think that's too much to ask. We do it for Olympic athletes. We do it for people who, gymnasts and
They do random tests for truck drivers. I have a friend that's a truck driver. He gets tested randomly every once in a while.
Absolutely. And so I don't think the good doctors shouldn't be offended. The only ones who are going to be offended are the addicts. And so for the protection of the general public, I think we should demand, and everybody needs to write and call and email their state and federal senators, their state and federal representatives. Let's get this urine testing done here and save America. Thank you, Doug. Super job. We'll be back after these messages. Okay, Doug, let's go to callers.
Well, let's head to Jackson, Mississippi. And Hardy, you're on with Dr. Wallach.
Hardy, you're on the air.
Thank you, Dr. Wallach, for taking my call.
Yes, sir. What's up?
Okay, we discovered to have a little calcium buildup in the left ventricle of the heart, and I wonder what can we do to reverse it or dissolve the calcium or bring it out? What can you do?
Okay, when you have a calcium deposit in the cardiovascular system, whether it's the heart muscle, a heart valve, aorta, pulmonary artery, all the small arteries, now this has to do almost always with a magnesium deficiency. This is called malignant calcification. It's a magnesium deficiency. And so what you want to do we know how much this person weighs?
178.
Okay, 178. Well, I would give them 2 healthy heart and brain packs per month. That would be 1 ounce of the OsteoFX Plus twice a day. That has both calcium and magnesium in it. And then it'd be 3 of the selenium twice a day. That's all part of the healthy heart and brain pack. So they're going to have 2 of those per month, and also be 2 scoops of the Beyond Tangerine 2.0 NutriCrystals of breakfast dinner, 3 of the EFA Pluses of breakfast dinner, and 3 of the EFAs of breakfast dinner. Also, I would have them take OsteoMag. OsteoMag, there's no calcium in it, but there is magnesium in it. And I'd have them take 2 or 3 of those twice a day. If they get a little diarrhea, cut it back to 2 twice a day. And that's going to give them the extra magnesium, and that will slowly, very slowly, it might take 6 months to a year to reduce or maybe even eliminate that calcium deposits in the cardiovascular system. It is doable, and certainly it'll stop the ongoing accumulation of calcium in the vascular tissue. Okay, that's the OsteoMag added to the 2 healthy heart and brain packs per month. Also, it's good to stay away from inflammatory foods, certainly. No fried foods, no processed meats with nitrates and nitrites, no oils, and no gluten, no wheat, barley, rye, and oats. This is going to be a complex thing, but it's doable. Okay, call me every couple of weeks. Let me know how this person does. Certainly, when they go back to the doctor, let me know what their next test shows. Okay, here. Doug, do we have time to start another one?
It's just about break time.
Okay, well, we'll go ahead and take it. Remind people, get a hold of my new book, Epigenetics, and you'll learn how to add 25 to 50 healthy years to your life. You'll learn why all the diseases said to be genetically transmitted are not. They're not. They're just simple nutritional deficiencies that afflict the DNA and RNA in your genes. Totally preventable, totally reversible. We'll be back after these messages.
Let's head to Victorville, California, and Peggy, you're on with Dr. Wallach.
Hello, Peggy, you're on the air.
Hi. I've had a lower back problem for a while. It really went intense about a month ago. My primary ordered MRI, and it was done Tuesday. I briefly seen it with my physical therapist the next day, and he said that the lumbar one, the upper right corner, is deteriorated and gone.
Okay, how much do you weigh, Peggy?
I'm overweight, about 50 pounds.
What do you weigh?
About 175.
Okay, how tall are you?
5'4.5", used to be 5'6".
Okay, so you have dropped. Do you have any things like peripheral neuropathies, any burning, numbness, pain in your legs or feet?
No, it's all the middle, the right side. It really went intense where I had to go for therapy.
Mm-hmm.
I don't do a medication, but I had to be on pain medication. But the therapy helped ease it. But what the physical therapy seen was that this one area is gone.
Okay, well, this is your lucky day. Got your pen and paper?
Yes.
Miss Shar, are you there?
Here.
Okay, this is a Shar thing. Here's a lady, who weighs 175 pounds. She's got serious osteoporosis. She's got some serious osteoporosis in one of her lumbar vertebrae, L1, looks like, lumbar vertebrae, and having all these symptoms on her right side. What would you do for her?
I would give her 2 healthy bone and joint packs per month.
Per month, okay. And if you had the CM cream, which could, there's one bottle of CM cream that comes with each healthy bone and joint pack, where would you tell her to put that?
Right where the pain is.
Very, very good. A+, girl. Thank you. Okay, Peggy, you got that. That's 2 of the healthy bone and joint packs per month. That'll be 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine NutriCrystals 2.0 at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. All that will be accomplished by the 2 healthy bone and joint packs per month. Use the CM cream for topical pain relief, and call us every 2 weeks. Shar has hit a grand slam home run there, and so you're going to find that you're going to be very, very happy with the result here. Okay? And again, give us a call in 2 weeks. You can start the diet immediately. You want to get rid of all the bad stuff. No carbonated drinks. No carbonated drinks, even club soda, anything you think of as being benign. Perrier water, can't have it. Nothing carbonated. Certainly no alkaline water, because it will neutralize stomach acid and reduce your ability to absorb minerals. And no fried foods, no processed meats, no oils, and no gluten. No gluten. And we'll be back with more Truth, Justice, and the Youngevity Way after these messages.
Let's head to Southern California, and Shannon, you're on with Dr. Wallach.
Shannon, you're on the air.
Hello, Dr. Wallach.
Hi.
I had called you about a month ago about our cat who has conjunctivitis in both eyes, and we followed your instructions exactly, but he has a very, very stubborn case of this, and we just can't get rid of it.
Okay, how much does a cat weigh?
10 pounds.
10 pounds, okay. Well, again, I would start out with a base of, I would change the cat food to something, make sure there's no gluten in it, so that we can maximize the absorption. Complete cat food has plenty of vitamin A and D and all that kind of stuff, but no gluten in it, no grains, okay, very important, so we can maximize absorption. Then, again, I would take a half a scoop of the Arthrodex, which is a complete supplement for carnivores, including cats and dogs and that sort of thing, half a scoop every day in his food. And also, I would get the Immortalium. Get a bottle of Immortalium, if we didn't talk about that. Once you grind up one of those tablets per day, grind up 1 tablet per day, and so one of these bottles is going to last like 4 months. So it's just 1 tablet a day, grind it up, and put it in the cat's food. Mash it down into the meaty part of the food. You want to be using a kind of a soft, canned, meaty, or poultry or fish-based cat food. And so you mash the tablet into it. That's Immortalium. Let's see if we can't get some of this conjunctivitis to resolve itself. We need some raw materials here. We need more vitamin A. We need more of the zinc and that sort of stuff. And so this will, antioxidants, this will help out here. Okay, Doug, let's go to callers.
Let's head to North Carolina, and Pat, you're on with Dr. Wallach.
Oh, Pat, you're on the air.
Yes, I'm 75, and I have a pacemaker, and my doctor, that is much younger than I am, died last week.
That's scary, isn't it?
I'm taking a different route, but anyway, one of the main things now is I understand I need a knee replacement.
No, you don't.
I hope not.
What do you weigh?
173.
Okay, 173. Okay, how tall are you?
Well, I used to be 5'7.5". Now I'm 5'4.5".
Okay, so you lost 3 inches in height. Okay. Do you have any bladder problems or heart arrhythmias?
My heart, I take medicine to keep it from going too fast.
Okay. Did the doctor say you had AFib or anything like that?
Yeah.
See, that's caused by your disc shrinking, and that 3 inches you shrunk is putting pressure on the roots of the nerves that control the rhythm and rate of the heart. So we may be able to help you there. Okay, Shar, this is a Shar thing. Here's a 173-pound lady, and she's been told she might need a knee replacement, and she's got AFib, and obviously shrunk 3 inches. So what would you give her?
Yeah, she needs 2 of the Healthy Bone and Joint Packs, and the glucogel in there will help her rebuild her vertebrae so that they're not the vertebrae, but the cartilage between the vertebrae, so it'll lengthen that distance between those vertebrae so they're not squeezing the nerve, so her heart will beat normal.
Very good.
And so she should be okay. She needs to avoid all the bad stuff, and she should get on a gluten-free diet. Everybody's got a gluten problem today.
It sounds like it, doesn't it?
Yeah.
Okay, so exactly right. Pat, your pen and paper, you don't need a knee replacement. Basically, you're shrunk, you have degenerative disc disease, and, of course, this is what's causing, as Shar said, a squeezing of the spinal nerves coming out from between T1, 2, 3, and 4, the thoracic vertebrae 1, 2, 3, and 4, which control the rate and rhythm of the heart. Knee problems or degenerative bone disease, degenerative cartilage disease, ligament, and so forth. Shar is perfectly correct. That'll be 2 Healthy Bone and Joint Packs per month. Are you on any medication for your heart?
I just take a medication to keep it from beating too fast with my heart. Pacemaker keeps it from being too slow.
Okay, so you do have a pacemaker and you have the medicine.
Uh-huh.
Okay, so let's get you, as Shar said, 2 Healthy Bone and Joint Packs has 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine NutriCrystals 2.0 at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. All that will be accomplished by the 2 Healthy Bone and Joint Packs per month. Give us a call every couple of weeks. You can start the diet now, as Shar said. None of the bad stuff, fried foods, processed meats, oils, and gluten. No wheat, barley, rye, and oats. It'll maximize absorption. No carbonated drinks during meals. Even club soda and Perrier water. They seem benign, but they will neutralize stomach acid. Stay away from them. And the odds are that you'll need a knee replacement is 0. Okay, so, okay, Doug, we got time to try another one here?
We certainly do. Let's head to Maryland. And Fred, you're on with Dr. Wallach.
Fred, you're on the air.
Oh, okay. Yeah, thank you for taking my call, Dr. Wallach.
Yes, sir.
Yeah, I was sick like a month ago, and I went to the hospital, and as part of the treatment, they discovered that there was a mass in my chest, behind my chest bone, and so after biopsy, which they sent to John Hopkins, it didn't show. It came back, and the biopsy wasn't conclusive, and so they were leaning between. They were saying it was between lymphoma and thymoma, and so the doctor had me do another PET scan recently, and before then she was thinking about doing surgery to take out the mass, but after the second PET scan and MRI, she was like, it's too big, she can't take it out by surgery, the mass is too big, and so I have to go do chemotherapy, and then after that we'll do surgery, and it's leaning much more towards thymoma.
Okay. Well, thymoma is benign enlargement of the thymus gland. Okay. Anything with oma on the end is benign. Now, tell me, how much do you weigh, Fred?
It's 5'6".
Okay. That's your height. What do you weigh?
That's my height. Oh, okay. I'm 138.
Okay. Now, do you have any other issues like skin problems, any eczema, dermatitis, or psoriasis, or rosacea on your face?
No.
Okay. Do you have any history of asthma or bronchitis?
No.
Okay. Do you have any history of belly problems, constipation, diarrhea?
Sometimes slight constipation, except for like indigestion.
Mm-hmm. Has that been going on? Has this been going on for a long time? 10 years, 20 years?
Indigestion has been going on for a long time.
Okay. Do you have any brothers and sisters?
Yes.
Do any of them have any asthma or skin problems?
No.
Okay. All right. Let's see here. What I would do is take and get rid of all the bad stuff. No fried foods and processed meats and oils. No gluten. Get rid of anything that's going to irritate this. And certainly, at 138 pounds, I would be a little heavy-handed here. I would take 1 healthy heart and brain pack per month. That would be, and get an extra bottle of selenium. So you could take 3 selenium twice a day. The 1 scoop of the Beyond Tangerine 2.0 twice a day. 3 of the EFA Pluses twice a day. 3 of the EFAs twice a day. Then I would get the Immortalium, take 2 of those twice a day, 1 bottle a month. And lastly, the Z Radical, take 2 ounces a day, 1 at breakfast, 1 at dinner. That'll be 2 bottles a month. And call us. You can start the diet right now, but call us as things go along here. We'll walk through this with you. Hang on. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity 90 for Life Crusade. And Doug, let's go to callers.
Let's head to Pennsylvania. And Barbara, you're on with Dr. Wallach.
Oh, Barbara, you're on the air.
Hi, Dr. Wallach. I'm calling about my husband. He's been a diabetic for several years, and he just recently had to leave his job because his vision has gotten so bad. For a month and a half, I have been giving him the blood sugar pack, but I'm not quite sure that I am giving him the proper amounts. And he has a neuropathy in his feet. His legs are swelled up. They sort of look like elephant legs.
Mm-hmm.
And but he can have his blood sugars down. He's on Humulin R500, which is supposed to be 5 times stronger.
We only have a few moments here. How much does your husband weigh here, Barbara?
He had gained 100 pounds, so he now weighs 288 pounds.
Okay, so he's close to 300.
Yes.
Okay, so we're going to have to dose him for 300. Okay, Shar?
Yes.
What would you give a diabetic that weighs 300 pounds?
So I give him 3 healthy blood sugar packs.
Okay, what would you do for the neuropathies?
Oh, he needs to eat eggs. I mean, he's probably got low blood protein, right? But he needs the ultimate daily to open up all his...
Okay, and what would you do for the cartilage and ligaments and stuff in his back, disc in his back and everything?
Disc glucogel.
Well, there you go. Very good. I would add the glucogel. Okay, so Char's exactly right. So what I would do is get him off all the bad stuff. In his case, it includes sugar, natural and processed, no juices, fruit, molasses, honey, all that kind of stuff's got to go, coffee syrup. Also, you got to get rid of the fried foods, the processed meats, the oils. And we live with truckers on the road. If your husband's a trucker, so we know what he, eats and goes through and everything. So you got to get rid of all the bad stuff. It's 3 healthy blood sugar packs per month. That's 1 ounce of the OsteoFX Plus at breakfast, lunch, and dinner. 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast, lunch, and dinner. 3 of the EFA Pluses at breakfast, lunch, and dinner. And I'd go ahead and give him 4 of the Sweeties 3 times a day, and that'll be part of the healthy blood sugar packs. So he'll be able to get 12 of those a day. And then I'd have him take 20 of the glucogel a day. So it'll be 3 bottles of the glucogel. It'll be 5 at breakfast, 5 at lunch, 5 at dinner, 5 at bedtime with a glass of water, and that's going to support and promote maintenance repair of the cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. And as his blood sugar drops on this nutritional program, and they will, blood sugar levels will drop, make sure he takes his fasting blood sugar every morning so he can adjust his medication appropriately. And for the vision stuff, I would also throw in the Immortalium. This big fella, I'd have him take 4 of those twice a day. That's 2 bottles a month of the Immortalium. I'd also have him take the Z Radical. I'd have him take 3 ounces a day, 1 at breakfast, 1 at lunch, 1 at dinner. That'll be 3 quarts a month, and this sounds like a lot, but he's a big fella. And how tall is he?
He's about 5'10".
Okay. Well, I would say that he's probably about 90 to 110 pounds overweight, depending on his bone. So he will lose weight on this program, but as he gets closer to 200 pounds, we'll be able to cut everything by a third here, okay? So the better he is with watching his portion control and so forth, the quicker we can get down to 2 of everything instead of 3 of everything. All righty?
Now, can I ask one more question?
Yes,
when he goes to bed at night, and if his blood sugars are down to 97, why does, without eating anything, his blood sugars rise to about 300?
In the morning?
Yes.
Yeah. Well, that's because his metabolism is pulling and converting fat into sugar, okay? And so what I want him to do before he goes to bed is have, say, 3 scrambled eggs and butter. Have 3 scrambled eggs and butter. Nothing after dinner other than those 3 scrambled eggs and butter, okay? No cookies, no milk, no juice, no fruit, no ice cream, none of that kind of stuff. He can just have 3 scrambled eggs and butter, maybe a half hour before he goes to bed, and watch what happens. Wouldn't hurt to throw in an extra couple of sweeties before he goes to bed, too. Good question. Okay, well, thank you, everybody. Thank you, Shar. Super job. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.